The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors, patients and dentists alike. I think we can quantify and qualify patients who have been on a war path to solve their TMD symptoms as TMD warriors along with the dentists. As I stated in earlier episodes, more and more patients are watching these episodes of TMD Demystified on Dental Town, which is the platform. And so I thought I'd acknowledge that in the introduction. I am Tony Urbanek. It is appropriate to call this problem, TMD, into play as a warrior, because actually it's an easy solution, but it has not been an easy journey to get here. With me, it's been a 50-year journey since I first finished my training, and I did have, for the time, 50 years ago, extensive training in understanding the theory and the actions, and specifically the surgery as it applies to temporomandibular joint disorder. I'm not going to bore you with any of the features that went on over 50 years, but I can say that for 50 years, it has been a journey for me. First 36 years as a surgical journey, doing over 2,000 TMJ cases, and then for the past 14 years, addressing this problem non-surgically after actually finding the solution for TMD. But before I found the solution, I had to find the actual pathology. I had to find the exact mechanism that allows this process that everyone calls TMJ to occur. Brings to mind just a fact. My associate was talking to an anesthesiologist very recently who was getting ready to do a procedure and anesthetize my associate for a brief procedure, and found out that he treated TMD and asked what TMD was. And my associate explained to the anesthesiologist what TMD is, and he said, "Oh, well, you mean TMJ." Even the anesthesiologists still call it TMJ. Everyone calls it TMJ. All right. The concept, the title, and the topic for today is, why do 50% of dentists prescribe a night guard for TMD? And that is a fact. 50%, roughly, of maybe more, of dentists, when they are faced with a patient that they believe have TMD, temporomandibular joint disorder, prescribe a night guard. And we're going to discuss here, hopefully thoroughly, but relatively briefly, I don't want to bore you, with why. The issue with night guards is they don't work in treating TMD. So why would 50% of the dentists prescribe a night guard for treating TMD? Well, the easy answer, and I've given this a lot of thought and investigation, and discussion with dentists. First of all, the easy answer is they don't know why they prescribe a night guard. The easy answer is that that's what everybody else does. And they have heard one way or another that that's what everybody else does, or they have an associate that that's what they do. And so they prescribe a night guard. That's the easiest of the answers. The second easiest answer is the dental schools don't train anything as it relates to treating TMD. And if they do, they just use a night guard. So the basic information comes out of dental school as to the right way to treat TMD. And then, of course, because there is no standardized treatment recommended or taught in dental schools, or no treatment at all is taught in dental schools regarding TMD, it leaves a big void. And it has been a big void for 50 years, both surgical and non-surgical. My surgical associates, compatriots, colleagues, had multiple answers, surgical answers. There wasn't one answer. There wasn't a standardized surgical answer. There were multiple answers given as to how to properly treat the TMD disorder and symptoms of TMD surgically. Two categories. One of them, it was through open joint surgery, where you would make an incision into the joint and do various machinations on the joint itself. We won't go into that. That's a surgical discussion. Or secondly, through an arthroscope, which is less invasive, but definitely less effective than any kind of open joint surgery. But those were the two types of surgical concepts that were used, scope versus open joint. And then the non-surgical treatments were more varied than the surgical treatments, all over the hill. I mean, just all over the place. So the question is, what really it boiled down to is 50% of the dentists really didn't want anything to do with treating TMD, because they knew by observation and experience with patients coming into their office and maybe being treated for a while with a night guard, finding out a night guard is not effective, and then they're out of bullets. They don't know what to do. And that's why 50% of the dentists, the other 50%, when they're faced with a TMD patient, either close their ears and say, I don't want to see the patient, or doesn't want anything to do with learning about TMD because they know nothing works. And then there's the 50% that use a night guard. All right, so, but what I want to discuss, hopefully briefly, is the logic or illogic behind using a night guard, because I gave us a lot of thought. And I assume that my dental colleagues, for the most part, are logical people. I mean, they're all smart. They're all smart enough to get through college, and also smart enough to get an invitation to go to dental school. And almost everybody finishes once you get into a dental school. Pretty much everybody finishes. So they're pretty smart, ladies and gentlemen. But why then do 50% of them keep prescribing a night guard when they're faced with a patient with TMD? Well, here is part of this week's blog that I wrote. So I'm going to have to read it to you to make sure I get it correct word for word. And then hopefully we'll make some sense of it. Maybe you'll kind of get a kick out of it like I did. 50% of dentists treat TMD by prescribing a night guard. A night guard is a plastic resin or acrylic tray that covers the surfaces of the teeth, to be worn at night for patients who clench or grind their teeth. It is well known and accepted fact that patients who clench or grind their teeth at night can damage or break their teeth. This is true. See it all the time as an oral surgeon, broken teeth because of clenching and grinding. Clenching and grinding of the teeth is called bruxism. So far, everybody's in agreement. It makes sense to protect the teeth from bruxism by covering them with a night guard. Night guards are successful at protecting the teeth from breaking or breakage due to bruxism. That's a fact, an agreed upon fact. It is also well known and agreed upon that bruxism is one of the three causes for damage to the temporomandibular joint. Actually, if you are looking at the percentages, bruxism actually is the most egregious and causes most of the damage to patients who have temporomandibular joint disorder. There are two other causes for damage to the temporomandibular joint, which are acute trauma and functional malocclusion. Bruxism, acute trauma, and functional malocclusion damage the TMJ, creating chronic inflammation. That is also a fact. Just read that again because that's an important fact. Bruxism, acute trauma, and functional malocclusion damage the TMJ joint, creating chronic inflammation. So far, we're all in agreement. But the illogical reasoning behind using a night guard for TMD is as follows. I gave this quite a bit of thought. When I was in college, I actually took a logic course where they teach you syllogisms. And I don't rely on logic to solve all problems in life. That is not what I'm saying. But I did take a logic course, and the major part of the logic course was to teach you syllogisms. If this is true, if this point is true, if this point is true, then the third point must be true. But a syllogism can be logical or illogical, actually. And the syllogism for night guards is very illogical, but here it is. Night guards are successful in preventing damage to the teeth from bruxism. True statement. Bruxism is one of the circumstances that leads to TMD. Also a true statement. We just went through those 2 points. Therefore, night guards should be used to treat TMD. That third point is not true. And it's not true because both dental damage and TMD are associated with bruxism, but association does not prove cause. They are both associated with TMD for sure. Bruxism is associated with TMD, and night guards are associated with TMD in that they prevent damage to the teeth due to TMD, bruxism. But therefore, night guards should be used to treat TMD is not a true statement. Association does not prove cause. Just because they're associated does not prove cause.